All right. So I am Manasi Jaiman. I'm a pediatric endocrinologist. I'm also the chief medical officer here at Aardvark Therapeutics. Thank you so much for having me here today. As as Matt and Santiago also said, this clinical trials are just an idea on paper, and we can't complete them without the patients and the family's willingness to participate. So thank you so much for allowing us to get here collectively to bringing more options to patients. So let's get started. All right, so it's just a disclaimer slide that we have in place. And just to continue in terms of a little background about Aardvark Therapeutics, it's a company that was started in 2017 by Dr. Tian Li, which many of you have already met. He's given many presentations on behalf of the company. He's also a physician, and his passion and dedication started with just that, for patients that he recognized had an unmet need. We're a company dedicated to bringing more therapy options to the PWS population with a continued unmet global need. Now, our trials are studying ARD-101, which is our study drug, and we currently have a phase 3 study called HERO, now enrolling. And as a company, we love our acronyms. HERO stands for Hunger Elimination and Reduction Objective. So let's go over what ARD-101 is and also how we're treating hyperphagia. So ARD-101 is an oral drug that is gut-mediated and largely gut-restricted. It binds to bitter taste receptors, TAS2Rs, that line the gut lining. It stimulates the release of several gut hormones that also include CCK. And just as a side, ghrelin, as you can see here in this pictorial, is a hunger hormone that increases when you're hungry. And after eating, other hormones like CCK are released to indicate to the body and brain that you're full. Now, we've had our phase 2 study completed, and you've heard us present this data before. But basically, what we saw in our phase 2 study in the PWS population was that there was a reduction in hyperphagia. There was a reduction in anxiety and food-seeking behaviors that were observed in several individuals with PWS. And the study was in individuals 17 years and older, and they were treated and well tolerated at the ARD-101 dosing. Now, for a phase 3 global trial, it is now enrolling in the US and in Australia for 13 years and older for the population. You receive active versus placebo. It's approximately 3 months with an open label extension following for approximately a year. Now, you've also seen us talk about hunger and appetite, and this is kind of foundational for our company in terms of how we think about these two entities. Now, hunger is a penalty avoidance, so pain avoidance drive. There's a need to eat, versus appetite is a reward-based drive. So there's a desire to eat. We believe hunger is mediated by local gut hormones, similar to what I already mentioned, CCK, and it's specifically acting through the gut-brain axis, versus appetite, which is often mediated by circulating hormones like GLP-1 and targeted systemically through the bloodstream. And I think this really helps us understand our safety profile that I'll also discuss briefly with you. Now, we are trying to address the root cause of hyperphagia, which includes impaired CCK signaling. There are downstream effects to this that we believe may include increased anxiety, emotional dysregulation, as well as affecting digestion, inflammation, and even fat accumulation. Now, here you can see what happens locally in the gut based on this image. So our drug is released in that gut lining. It binds to intestinal TAS2Rs. There's an endogenous release of these key gut hormones that I've explained before, and it activates this gut-brain signaling to inhibit hunger. And ARD-101 has a very unique mechanism of action, obviously because it's mostly and largely gut-mediated and gut-restricted, and is targeting the root cause of hyperphagia specifically. In terms of what we've seen so far, so first I'm going to talk to you about the effects, and then I'm going to talk to you about the safety profile. So in our phase 2 study, patients were 17 years and older. It was a 28-day study, and we used an HQ-CT questionnaire as standard for these clinical trials. We saw an average reduction, which you can see on the right side, of approximately 8.5 points. This was an open label study. We also saw early signs of improved fat and muscle balance. Now, obviously, this is very encouraging to us, but not only did we want to see that it was effective, but is it safe and well tolerated? So that brings us to our safety profile. Now, we have dosed over 70 people with no serious adverse events, and this across all of our studies. Most of these AEs have been, in fact, mild and all resolved. There were no known problems with other PWS medications. There's no expected liver and kidney risks, given our unique mechanism of action. And there's no expected risk to the immune system as well, again, because this drug is largely gut restricted. Now, seeing what we've seen with our safety profile, with the effects we've seen in the PWS population, we knew we had to go into a phase 3 trial design to really see it in a larger population and offer this for patients and families. So this is a schematic of our phase 3 trial design. So it's PWS patients that are 13 years and older, and opposed to the 17 years and older, which is in our phase 2 study. This is also a 12-week or 3-month study design, followed by a 1-year open label extension period and a minimum of 1 year. Now, patients are randomized. They'll receive either treatment arm or placebo, but all patients will have the opportunity to receive active drug once they're in open label extension. Again, our primary endpoint here is looking at HQCT9 questionnaires. One thing that we kept in mind in our population here specifically is to decrease the burden for families and patients. So actually, we do not have fasting requirement for labs. We are supporting as much as we can for the families, things like travel, lodging, because we also understand being a part of a trial is a burden in itself. And you already have a day-to-day, very strict schedule that you have to follow for your families and your loved ones. And so we took that in mind as we designed this trial. And it was really based on the feedback from the families, through our sites and investigators, through the advocacy groups, that we recognize the need to improve our design over time. And so I think we've come up with a design that will be accessible to most families and patients to participate. You may ask where we are. So we're a global clinical trial in 9 countries. And as I mentioned, we're in the US, in Australia, but we have several countries that will be hopefully opening very soon. So you will all have an opportunity to participate. Lastly, I want to share our QR code. We also have all of our information on the clinicaltrials.gov, but this QR code will also help guide you to our website that has all of the key inclusion, exclusion criteria, and kind of the other key components I already discussed today. Now, again, as all the other presenters have mentioned, we're deeply grateful to the patients and families that participate in our clinical trials. Their support makes progress possible. We're also really thankful for the investigators and sites who are true partners with us on this, and their commitment ensures that our studies are conducted with the highest care and integrity. So thank you so much for allowing me to speak today, and I'm happy to take any additional questions.